Right. Right. Well, welcome everybody. My name's Steve Hurst, and I am currently the head of Department of History, Politics and Philosophy at Manchester Metropolitan University, and it is my honour and privilege to be hosting this lecture for the second year in a row now. I guess everyone, or most people, will know why they're here, but I'll give a brief background for those who may be new to this. So this memorial lecture is given in honour of Tom Hurndall. So Tom was a photography student at Manchester Met who died in 2004 after being shot by the Israeli Defense Forces while he was in Gaza working with Palestinian families and Palestinian children. And since 2005, we have, or the university has for the most part, hosted a memorial lecture in honour of Tom and his work, in which we have hosted a variety of distinguished speakers who have given lectures on themes related to the Israeli-Palestinian conflict. So I'm delighted to be hosting this again, even though I should add at this point that all the heavy lifting for this operation has been done by Ian. I've just turned up at this point to be a figurehead, but really the thanks for getting this off the ground and making this happen are Ian's and not mine. They should go to him. The speaker this year is Professor Lara Sheehi, who will be speaking on psychoanalysis under occupation, which sounds fascinating. I'm really interested to hear this. Professor Sheehi is Assistant Professor of Clinical Psychiatry, Psychology, I beg your pardon, at George Washington University. I can't read my own notes. And she is also Secretary of the Society for Psychoanalysis and Psychoanalytic Psychiatry, which is a mouthful, and Chair of the Teachers Academy of the American Psychoanalytic Association. So her work is mainly on decolonization, decolonial struggles, and at the intersection of race, class, gender, power, and psychoanalysis. And the topic that she's going to be speaking on today is psychoanalysis under occupation. I will just add briefly before I hand over to Lara that not only did I turn up slightly late for this, but I will be departing shortly after 7 because I have something to go to, which involves having appropriate ratios of adults to children. If I'm not there, it can't be done. So that one I have to make sure I get there for. So if we're still going at 7:05 or so, then I will be dropping out, but Ian will be able to host or chair any further questions up until 7:30. So no great harm will be done. Okay, so without further ado, then I'd like to hand over to Lara and let her give her lecture.
Thank you so much, Steve. أهلا وسهلا بالكل. مرحبا وأهلا وسهلا. أنا كتير مبسوطة وفخورة بوجودكم وبوجودي معكم اليوم. Hi, everybody. Thank you so much. Again, a thank you to Manchester Metropolitan University and the Department of History, Politics, and Philosophy for hosting this event. To Dr. Stephen Hurst, of course, for his generous introduction and for taking this sort of position to do this as well. And of course, to Ian Parker, without whom this talk wouldn't have happened. And honestly, whose fierce solidarity is moving to me even across the distance. So thank you so much. I also want to thank and extend my deepest love and solidarity with the Hurndall family. It's the moving honor for me to carry Tom's legacy today, a responsibility I take seriously, and I approach it with the militancy that does his life justice. A word on today and just a framing of my talk. I will introduce my talk and sort of my positions around this, why it's important in the current sociopolitical moment. I will introduce folks to the concept of psychoanalytic innocence as it pertains to Palestine. And most importantly, I will be speaking the words of the Palestinian clinicians who've entrusted us, and us being my partner and my husband and I who wrote this book together. They've entrusted us with their work. And so it's really important for me to center Palestine and Palestinians and our Palestinian comrades in this talk. Those of you might have heard pieces of this through the years. We've been in community and struggle with our Palestinian comrades for decades, but particularly around this work. And for those of you who've read the book, first of all, thank you. And I hope that, like us, there's something like for us, every time we take up this talk and this material, that there's something new that emerges in our communal space together today. So I'm hoping that even if you've heard it, that something will emerge today together. So in Black Skin, White Masks, Fanon, in his characteristically unrelenting clarity states, quote, "In this work, I have made it a point to convey the misery of the Black man, physically and affectively. I have not wished to be objective. Besides, that would be dishonest. It is not possible for me to be objective," end quote. Likewise, for me today, it is not possible for me to be objective. Today, I'm speaking to you from the stolen and unceded land of the Pamunkey Confederacy. This acknowledgement, far from being enough to counter the ongoing wrecking effects of settler colonialism, is for our purposes today understood as a small and necessary act of reclaiming disavowed truths, as well as attending to the textured violence of racial history in this settler colony, as we also center another condition of settler colonialism. This truth in history, through innocence, is often disappeared. It becomes displaced. This disappearance, a disavowal in psychoanalytic terms, maintains a particular social order while hiding the mechanisms by which that order is maintained. So the act of reclaiming disavowed truth and unabashedly naming them as such is the method by which I heed Fanon's call and attempt to counter in real time the perniciousness of what I've come to understand and what we have highlighted in our book around psychoanalytic innocence. I'll speak to that a little bit more. But this is especially the case in settler colonialism that is happening in real time in Palestine. Objectivity, as it is encoded into psychoanalysis, of which neutrality is a subset, is one such valve of innocence, something that Fanon very early on was working to shift in psychoanalysis to include a sustained engagement with what he called sociogeny. This framework, as I've come to understand and practice it, has at its core a militant disruption of the violence done by seemingly innocent psychoanalytic praxis and theory, heeding the call to practice what Glenn Coulthard in Red Skin, White Masks has termed a, quote, politicized anger, and also, quote, disciplined maintenance of resentment, end quote. Not as a deflection from the depth work of psychoanalysis, but rather as a contingency for vibrant livability in the face of oppressive structures, as my Palestinian scholar and sister, Nadira Shalhoub Kavrukian, reminds us in her work. It is fitting then that in a talk about psychoanalysis under occupation, especially within the settler colonial condition in Palestine, that I reject objectivity and embrace a Fanonian methodology of militancy in speaking to Palestinian presence, sumud or stalwartness in the face of Zionist violence. In this way, I myself refuse to collude with psychoanalytic innocence. The concept of psychoanalytic innocence emerges from our book, Psychoanalysis Under Occupation, Practicing Resistance in Palestine, that my partner, Stephen Sheehi, and myself have written. While the concept underlines its ubiquitousness in our field, in the book, we use it to discuss the ways psychoanalytic theory and practice can work in service of violence in the context of the settler colonial condition in Palestine. For example, we attend to how ideologically psychoanalysis' insistence on dialogue, reason, and working through, without a sustained analysis of the material conditions of dispossession in Palestine, acts under the pretense not only of neutrality and objectivity, but also universalism, empathy as an endpoint of process, and the myth of safety. We name how in this context, psychoanalytic innocence works in concert with the logic of settler colonialism and occupation, denying the everyday violence enacted on Palestinians and conveniently forgetting how this is also structured by the unconscious. Indeed, here we map how psychoanalytic innocence relies on the hegemony of what Lynn Layton has termed, quote, normative unconscious processes. Deployed in this way, psychoanalytic innocence is particularly insidious because it simultaneously forfeits psychoanalysis' supposition of unconscious process and structure while also ignoring material reality. Psychoanalytic innocence, in our eyes, is not understood as an intrapsychic process that disrupts the analyst's thinking, but rather as an innocence that pervades the ideological position of the practice, the theory, and therefore the relational space of psychoanalysis. In this way, one might understand that the analyst is the one that comes to enact a reversal of what Christopher Bollas terms violent innocence, if only because they have, quote, what Haggerty would say, the psychological power, which is understood in terms of who has power to name the psychology of another, end quote. This is why in the book, and here today, I want to center the work and practice of sumud and resistance by two of our clinician comrade colleagues who generously shared of themselves. As in other examples in the book, not only do we have permission to share this, but the clinical cases we platform are a jumping off point. Rather than engaging in a maneuver of psychoanalytic innocence where the content alone comes to hold the energetic pull of clinical attention, I want to focus on the both-andness that Palestinian clinicians consistently alert us to. That is how their clinical work comes to be both a space for resistance for their patients and also an extension of their own resistance against settler colonial hegemony. Indeed, what we consistently came upon in our work alongside our comrades was that a collective practice of sumud is unified through precisely its engagement with creating and maintaining life and life worlds, as well as political and historical realities for Palestinians by Palestinians. I want to start off with a clinical example, and then I'll move into a supervisory example. The following clinical example was shared with us by Youad Ghanadri Hakim, and it shows up in the book in a powerful way, but I'm hoping I can breathe life into it by speaking it out loud today. Youad is a brilliant clinician and wonderful revolutionary soul with captive citizenship in the Zionist state. After meeting Youad in Beit Hanina, we continued to have conversations with her and witnessed her speaking publicly and in psychoanalytic groups over subsequent years, conversations that only increased our admiration for her critical insights and her depths of empathy, let alone her political conviction. One particular case she shared with us is that of Amjad, a man in his early 30s who worked in an Israeli textile company inside the 1948 borders of the state now known as Israel. Though he had a home in the West Bank, Amjad, along with his 3 children and wife, who was a homemaker, rented a house in an officially annexed village near Kalandia out of fear of losing his identity card that allowed him to live and work in Jerusalem, Al-Quds. Amjad visited the clinic as he suffered from sensations of a lump or a ball, in Arabic the word is tabi, in his throat, whenever he became nervous. Amjad had undergone many medical tests to establish treatment for what he felt was a medical condition, though each medical consultation indicated that his throat was, quote, 100% normal. After a year, one of Amjad's physicians suggested that he seek help from a psychologist. Amjad was initially very embarrassed in the clinical space and found difficulty speaking about himself, as well as anything beyond what he continued to feel must be a medical condition. Youad told us that he explained that there were days when he felt the ball in his throat was getting bigger, while other days he felt it getting smaller. Youad remembers asking him to share with her his reflections and observations about what sometimes made the pain increase to such a degree that he was barely able to speak. He often entered her room with a shy smile and initially waited for her to start speaking. She characterized him as someone who took great care in arranging his sentences and words to make himself understandable. Youad indicated that he would often display great difficulty producing utterances, often experiencing word-finding difficulties, and he also shows signs of obsessiveness in searching for the correct way of saying things. She told us that as a result, early in their sessions, Amjad mumbled very short sentences, speaking in choppy words and broken phrases. He would tell her, quote, "My words stop up in my throat. They knot up and become a ball. They suffocate me when they don't come out," end quote. Amjad was annoyed with himself, and Youad felt it too. she also felt the ball move from his throat into her stomach, a knot she could not release. Amjad's therapy with Yoad spanned approximately a year and a half of weekly sessions, psychoanalytically oriented sessions. She reported initially having been supervised by an Israeli Jewish psychologist. Yoad noted that while the lore of the institution in which her psychoanalyst supervisor was trained was such that everyone held themselves to professional standards and believed in the fundamental premise of psychoanalytic theory and practice, she often sensed this collapse of psychic space when her Israeli supervisors, especially in the case of Amjad, tried to theorize Palestinian patients seen by Palestinian clinicians. In the case of Amjad, rather than being curious about the psychoanalytic meanings of Amjad's symptoms, the supervisor insisted that Amjad suffered from an anxiety disorder and that only medication could solve his problem. Yoad felt deeply conflicted by this assessment as she relayed her gut feeling, or what we might read as attuned clinical intuition, countertransference, that Amjad likely had much more to say. She feared that medicine would potentially preemptively shut Amjad and his exploratory process down and foreclose opportunities to collaboratively read the symptoms as signs of a deeper communication about his experience and, most importantly, about his being. Yoad recalled disagreeing with her supervisor openly, despite being painfully aware of the power differential and the potential implications of doing so. She insisted that she should continue to be curious about Amjad, about what he was trying to communicate in the displacement, in the countertransferential space, and in the dyad, even if this was not explicitly articulated. This, of course, represented an alignment with a psychoanalytic tradition and technique in which she and her supervisor were trained. Despite this, her supervisor insisted on psychiatric intervention, and therefore Yoad suggested that he consult a psychiatrist, an intervention that she felt ultimately pacified her supervisor, but which Amjad refused. Despite refusing medication, or perhaps because he did, Yoad noted that Amjad went from barely speaking to exquisite detailing of his many concerns, his fatigue from work, thoughts about his children, concerns regarding the relationship with his wife, struggles of travel through checkpoints, and his relationship with his brothers. Yoad felt confused about the purpose of these details. She understood their literal meaning, but often found herself affectively discombobulated, in her words, wondering what he needed from her. She also came to feel suffocated. She reported feeling frustrated, as though Amjad had escaped from previous silences into speaking so much that no room was left, even for breathing. As such, she often had the feeling of the room being heavy with thoughts and words that were left unsaid, though they were very much present. In this, she reflected how both silence and speech can be defensive, used to fill up the space, but never reaching the depths of the patient or the clinician. While Yoad was committed to and engaged in intensive self-reflection of the work, she reported that her Israeli supervisor often downplayed her approach and considered her surface work with Amjad as a great success because Amjad had become comfortable with her. Her supervisor dismissed concerns about Yoad's countertransference and was not curious about Yoad's feeling that Amjad, quote, was making a lot of noise with no depth, end quote. Yoad was especially concerned as the ball in his throat lightened as he spoke, but immediately returned and grew whenever the session ended. She felt that she and Amjad were playing a game of negotiation, and yet in reality, there was no solution. Yoad often was confronted with conflicts regarding how to speak about the work with Amjad in supervision. She noted the psychoanalytic importance of having associated to negotiations, especially in the context of Palestine, especially in the context of supervision with an Israeli supervisor. While she understood intuitively that associations had meaning, especially in a countertransference, Yoad found herself at a loss of how to express this concern to her supervisor, especially as a supervisor consistently did not share Yoad's concerns. Amjad himself was happy he did not feel any discomfort in his throat during the sessions. However, he stated that outside the clinic, his painful feelings returned and he was unable to get rid of the ball. Yaad noted that this was an important turning point in treatment, as it opened up a space for her to ask him about breathing in real time without being bogged down only by talking. More specifically, Yaad indicated that with this opening in the material, she had asked him to put aside the distracting notes he had taken to bringing into session and to ask him to talk about his difficulty breathing with specific focus on when he was feeling suffocated. While he did not answer directly, Yaad shared that he was smiling in his silence, and she felt it was important to self-disclose in service of the clinical process. Specifically, she shared with him that she sometimes felt suffocated in sessions because of over-talking that seemed to leave little, if any, room for anything else. She recalled that in this moment, he smiled again and indicated that as his feeling of suffocation increases, it turns into a ball in his throat that further chokes him. Yaad worked with Amjad to uncover and recount all the moments in which he had felt suffocated. When his wife reminded him of payments for the pathetic car he had bought, when he passed in front of his closed house in the West Bank, when his Israeli boss asked him to bring him fresh olive oil from their tree in the West Bank, when he entered the area controlled by the Palestinian Authority, another part of his own country, and he read the sign, quote, "No crossing border, dangerous area." In every session after that pivotal moment, Amjad talked about the specifics of his breathing difficulties, his choking, and sighed a lot as he did so. At this point, her supervisor indicated abruptly that it was time for Yaad to terminate Amjad's treatment because she was happy with the achievement he had made and felt that there was no further growth or depth to explore. Yaad remembered feeling very upset about this decision, especially as she had just started to experience an important affective shift in the room. Because in the moment she felt she did not have the power to do otherwise, she initially followed her supervisor's advice and told Amjad that they needed to move to termination. She recounted movingly how Amjad exploded, shouting in a way that she could have never previously imagined. While yelling, Amjad told her she was weak and that she was, quote, "not the one who owns the decision or the decision-making process." He continued, accusing her of, quote, "not really being concerned with taking care of and protecting sick people," end quote. Yaad remembers being shocked by the fact that he was screaming and that she did not fully understand what was happening in the moment and didn't have the space to reflect fully about her countertransference. But she also remembers feeling internally happy, very happy. After this moment, Yaad made the decision to continue Amjad's treatment alone without consulting her Israeli supervisor any further. While in future sessions, they did not explicitly talk about Amjad's outburst, she noted that she had started to feel that he had become taller, as if his stature had gotten bigger. During this phase of treatment, Amjad started talking about anger. More specifically, he spoke about getting angry inside his car, the lousy car in which he crossed the Kalendia checkpoint twice a day, once on his way to work and once on his way back. Amjad reported getting angry in his car whenever he read the word ma'bar, which translates checkpoint crossing, on a sign. He reported feeling anger because he did not feel like he was just crossing from one area to another. Rather, he felt that he was inside one space, but was prohibited from free movement in another while standing at a checkpoint. This is Amjad's words. Why do they call it a crossing? This is a checkpoint, a hajiz, a checkpoint, a checkpoint. In a session soon after he began to uncover his anger, Yaad reminded him that they had not spoken about the ball in his throat for quite some time, inquiring where it was and if it remained a symptom for him. She recalled Amjad stating, quote, "Sometimes I feel that there is hate or hatefulness in my throat and not a ball." This is when she decided to ask him who he hated, to which Amjad responded, I hate myself. After a moment of silence, Yuad said Amjad opened up about an incident that had happened 2 years prior. He reported taking his 7-year-old daughter in the morning with him on his way to work, as she had wanted to meet with a friend in Jerusalem. He remembered that his daughter was very happy that morning, as she had been fantasizing about this magical day with her friend for quite some time. He recalled that she wore a beautiful new dress the night before out of excitement and put flowers in her hair in the morning they set out. Amjad further shared that his daughter was singing throughout the trip in the car. She's singing in Arabic, but it translates to bouncy, bouncy, bouncy ball, bouncy, bouncy over the wall. When they reached the Kalandia checkpoint, Amjad was surprised to see tear gas and a confrontation between the occupation army and protesters. Worried about his daughter, he tried to reverse, but his car was stuck in the midst of hundreds of cars, all trapped, motionless. The situation was increasingly frightful for a quarter of an hour, after which it completely calmed down, but the occupation soldiers closed the checkpoint and prevented the cars from moving. Amjad recalled that his daughter had begun to cry uncontrollably during this time, and that he was hugging her, trying to calm her and contain her fear. Eventually, she told her father she needed to use the bathroom. Amjad was not convinced that they would be allowed to access a bathroom, but got out of his car to inquire as his daughter's crying was escalating and he could tell she was in considerable discomfort. Amjad told Yuad that he waved down a settler soldier, telling him, "My daughter needs a bathroom." Instead of responding to him, the soldiers ran towards him with their weapons raised. He says, "I raised my hands towards the sky and shouted at them, 'She wants a bathroom, please let me pass.'" The settler soldiers yelled, "Get back in your car, get back, get in the car. Tell your daughter to piss herself in the car." All the while, his daughter continued to cry, "Baba, Baba, I need a bathroom." Amjad recalled getting back in his car, hugging his daughter, and with a trembling voice telling her, "Do it here, Baba. Do it quietly here in the car." He remembered how at that moment, his daughter's screaming stopped as the smell of urine spread in the car. Amjad looked at his daughter and found her shedding silent tears. He hugged her as he drove them home, and as he looked at the checkpoint gate, he remembered the cheerful song of his daughter at the beginning of the day. "Bouncy, bouncy over the wall. We are not you, ball," after which he immediately felt a ball stuck in his throat. Yuad remembered how Amjad finished describing the incident and witnessed tears flowing down his cheeks for the first time. She remembered tears rolling down her own cheeks as well, as she also became aware of a wheal in my throat as they ended the session. Let's go pause for a second. This case is important for many reasons, not the least of which is the distilling of the banality of violence enacted daily on Palestinians, whether they be patients or clinicians. Yuad tells us that Amjad's treatment was one that I will never forget ever in my life. She confided in us saying, "I often remember Amjad. It guides me professionally and personally and privately. It changed me in the way that I practice." The effect of this case on Yuad is what we focus on in our book. It encapsulates the condition of the Palestinian as an extension into the clinical and the clinical into the personal and social. But more specifically, it allows us an opportunity to acknowledge how Palestinian clinicians refuse to erase the signs of Zionist settler colonialism embodied in the clinical space, both in the therapist and the patient, no matter the systemic pressure or the demands from supervisors, for example, to reduce them into primarily behavioral beings with no depth and no interiority. In a depoliticized condition, One might say that Amjad's psychological symptoms are experienced physically without any medical basis. The Israeli supervisor identifies a symptom as a conversion symptom, as a symptom of an anxiety disorder. She sees him primarily as a resistant patient who refuses to speak, to articulate thoughts, or to open up and be honest. That's why she was happy when he started to speak a lot. We call this ideological misattunement that saturates psychoanalytic thought, analysis, and treatment. An inability to identify processes precisely because the analyst or clinician is implicated by and imbricated in the ideological matrix in which the patient is also entangled. This exemplifies psychoanalytic innocence. To bring it back to our talk today, if following Fanon and others, we understand psychoanalysis as being primarily a method and practice of reading, organizing, and translating the unconscious individually as well as collectively and socially, and I would add politically, then the mechanics of psychoanalytic innocence work to at once obfuscate this process and insist on the fact that the obfuscation is not happening. Therefore, it maintains innocence. As I said before, this process is not individual or individualized, but rather is structural and constitutive of our theory and practice deployed to preserve psychoanalytic practice as is, especially in the settler colonial condition. Here, I'd also like to draw our attention to how liberal and humanistic psychoanalysis maintains this naturalization, remaining complicit through forms of oppression by seeking to graft a universalized, healthy adaptability onto colonial and racialized subjects whose humanity and psychic interiority are negated. In a liberalized version of psychoanalytic theory, these colonial subjects are only able to access empathy when they occupy the position of victim and surrender their rights to experience political and material realities in full alignment with their experience and social context. Yoad's supervisor attempts to mobilize psychoanalytic innocence. And like all of the Palestinian clinicians alongside whom we learned, Yoad was a willful subject engaging in the politics of refusal, a Palestinian clinician unwilling to succumb to the colonial violence inflicted on her as a clinician or on her patient, Amjad, a Palestinian clinician insisting on indigenous Palestinian presence, even in the face of settler aggression that insists on erasing the native. This is a prime example of smooth. To the Israeli settler, in this case a supervisor, Amjad's silence could only be a defense, a deflection from confronting the unconscious. Without attending to the structural and material realities of his world as a Palestinian, she reads his symptoms as just nerves that can be medicated. If we were to collude with psychoanalytic innocence, we might mistake this supervisor's racist and colonial aggression as a disaggregated, singular act of random violence perpetrated by the settler state of Israel, of random violence, rather than as an essential part of a coordinated system of violence, oppression, and erasure perpetrated by the settler state of Israel, here manifesting in the supervisee space. In this way, Yoad also alerts us to the importance of the Palestinian body, individually and collectively, as a site of violence, as well, and more importantly, as a site of resistance and sociability. The somatization, therefore, is not a symptom of a disorder. Rather, it's a symptom of functioning within material reality that stops up the flow of the unconscious, the social, and the intersubjective. His symptom, confronted and read through the context of Palestinian intersubjectivity, does not only direct us to the settler colonial condition, but also makes us consider how the occupation may manifest itself, or perhaps can only manifest itself within the context, for example, here, of Palestinian masculinity, through somatization. Otherwise, it might be dismissed or minimalized. My own additional reading is also that the supervisor felt compelled to stop Amjad from speaking, lest he disclose the realities of violence being done to him by the Israeli state with which she was so identified. Indeed, there's no place for a Palestinian-speaking subject in the settler colonial regime. The suffocating ball itself is not the only symptom, something which Yoad recognized, herself a Palestinian colonial subject. In this way, the symptoms were hyper-visible to her, but the symptoms were illegible to the ideologically misattuned Israeli supervisor. The symptom of silence and empty speech signified the loss of the ability to speak deeply in Yuad's language, to articulate meaning, as well as the blockage to affectively express the damage inflicted on the interior self by the daily violence of occupation. Here's where we can understand Yuad's decision to continue working with him, despite her supervisor indicating she shouldn't, as a liberatory and ethical imperative that most movingly disrupts the settlers' insistence on futurity. In making this decision, Yuad demonstrates that she saw his symptoms as a hajiz, a checkpoint, a barrier, just as he did, just as we do in the everyday life of Palestinians, as our clinician colleagues tell us. In this way, she actively disrupts settler colonial logics and insists on indigenous presence. Ali, another Palestinian clinician, similarly reminded us of the importance of presence when he spoke to us. I'm quoting him here. The place where our clinical supervision by Israeli supervisors takes place is an old Arab house in which little, if anything, has changed since 1967. From the first time I stepped in this house in Talibiyah, I felt a lump, sitting in a stolen Arab house with colonizers, talking about a profession supposedly based on humanism and in support of humanity and the humane, end quote. Ali draws our attention to the condition of being a captive settler colonial citizen, as Nadim Rouhana identifies them. Ali, a captive settler colonial citizen in supervision also, is surrounded by the traces of the undeniable material evidence of Palestinian presence. This presence stands in the face of a common disavowal by the powers under which he finds himself, whether that's the apartheid state or the Israeli clinical supervision. Ali further recounts his experience in supervision, locating not only the settler colonial spatiality of training, but also the language one is forced to speak to achieve accreditation, language symbolic and of the colonizer's tongue, and also the assignment which the settlers delegate to Arab trainees. He says again, you're an Arab therapist, a Palestinian. You're charged to treat Arabs of East Jerusalem in Arabic, the marginalized and weak population subject to occupation. So you're sent to treat them with texts written in Hebrew. You present the case of your patient in Hebrew to your Israeli supervisor. She lives in a colony on the land of your grandfather. She finds it hard to understand you, although she assures you that she cares about, quote, the Arabs. She can't see any need for therapeutic intervention because the patient is low functioning, or in her words, the patient is a simpleton, end quote. In another conversation, Ali describes to us another Israeli supervisor, so we're seeing a pattern here, insisted that Ali diagnose a patient, a Palestinian man from Shafat, with a psychotic disorder. This is despite no supporting clinical material over a significantly lengthy treatment period. While Ali attempted to showcase how this diagnosis was in fact clinically counterindicated, the Israeli supervisor insisted. Her rationale was that the patient, who had considerable technical computer training, was, quote, grandiose, trying to create a computer processor that would surpass the processors in current day use. In the supervisor's assessment, this clearly meant that the Palestinian patient must be psychotic. Contrary to the supervisor's opinion, Ali found that the patient was not only not psychotic, but cogent and remarkably intelligent. Ali remembers trying to convince his supervisor of his clinical position and rationale, aware of and conflicted in his attempts to do so, like Yuad, because of the power imbalance. She replied to him, quote, there is no way this guy can actually be doing this. He must be psychotic. There's no way he actually knows how to work with computers, end quote. Ali confided in us his shock that the supervisor could not reconcile her, quote, Orientalist ideas about Arabs. The supervisor was Israeli. She couldn't understand how an Arab could be smart, not like a stereotype of an Arab who's a nobody. end quote. Ali identifies this shortcoming not as a personal trait of his supervisor alone, but as a built-in feature of the social relations between the colonized and the settler citizen, between the Israeli clinical supervisor and the Palestinian trainee or clinician. Like the inability of recognizing the old Arab home where the supervision takes place, as itself a site of psychic violence, historical theft and dispossession, all of that was legible to the supervisor, illegible to the supervisor, who sees herself as sympathetic to the Arabs because all she could see was the primitiveness of the Palestinian patient. He concludes his story saying, "They look at you. You're always less than. You know less, your culture is less, and yet they teach us. They teach us, and across the street, only a few meters away, is another stolen house, Edward Said's house, and they have no clue. They see us as if we come from nowhere. They want to give us the honor to be trained by them so as to help us treat our people," end quote. These are social relations and the ideology that authorize the legitimacy of the settler state through the consent and collusion of psychoanalysts, psychoanalytic psychologists, and psychoanalytic theory, as well as the structures of clinical training. The multiplicities that structure the social and professional relationship between colonized Palestinian trainee and the Israeli settler supervisors, not to mention also the Palestinian patient like Amjad, are marked by essential ideological disavowals. Ali realizes that the Palestinian trainee is required to accept and reproduce these disavowals. The Palestinian trainee is expected to be, quote, a good Arab, an appreciative Arab, a Hebrew-speaking Arab, not a bad Palestinian, primitive, Arabic-speaking, and ungrateful, as Fanon notes. As with Yuad's supervisor, when Ali seeks to practice therapy in service of Palestinians' mental health, his psychoanalytic supervisor falls back on CBT, despite otherwise deriding behaviorist treatment. This is an example of ideology. Ali is told quite specifically that his patients lack capacity for long-term therapy. In many ways, he's made to feel in a parallel process that he too lacks capacity. In this way, alienation is built into the training site, the training process, training material, and supervision. It is to be passed on from the colonized supervisee to their patient, and that is hegemony. His only point of entry is that of an obsequious good Arab who can translate the lack of interiority of the Arab back into the depth and complexities of Hebrew in service of managing Palestinian primitivity into sedate compliance. It's important to note, with these examples that I've given you today, that the central point of our book is how Palestinian clinicians and Palestinians themselves not only work to resist the settler colonial hegemony and the ideological framework in which it works, but that their work is an affirmation of a healthy and complex Palestinian selfhood, an affirmation of Palestinian life and lives. Our work then hopes to shine light on how Palestinians, circumscribed by violence and death, operate internally and communally within a psychic political economy of life through various enactments of sumud, some of which I've described here today. This psychic political economy of life defies being objectified as a victim. It struggles to maintain, even though at times tragic, desperate, and to some heroic ways, dignity, commitment, and responsibility to themselves as individuals and to their communities. We build on the insights of, for example, Nadira Shalhoub-Kavarkian about how psychic political power emanating from sites of death generate a collective psychosocial embodiment of everyday resistance. More specifically, we identify how the psychosocial practices of Palestinians, through the experiences, analysis, and technique of clinicians, affirm the centrality of the embodied psyche, al-nafs, breath, self as the primary site for Palestinian life, Palestinian willfulness, and Palestinian resistance. Thank you.